Welcome to today's edition of IARF 5-Minute Focus, discussions with leaders in disability services. I have the honor of being the IARF President and CEO, Josh Evans. And today we are joined by the Executive Director of Transitions of Western Illinois, Mark Schmitz. Mark, thank you for joining us.
I'm glad to be here. Thank you.
So Mark, as you know, the format is we want to try to have a good discussion in 5 minutes with everybody's attention span. Everybody's got a lot going on, but we think in 5 minutes, the public and everybody that wants to watch can get a good sense of the great work that your organization does. Could you spend a couple of minutes telling us about, what is it that Transitions of Western Illinois does?
Well, we're all about helping people to lead their most meaningful life and to have the supports they need to do that. And we do that in a lot of different ways. We have been from our very beginning a mental health services provider. So we do outpatient and residential substance abuse and mental health treatment. We also have for about 40 years provided different various array of developmental disability services, day program and residential and workshop type of employment opportunities to support people. In addition to that, we also have a school that we operate for kids who have severe disabilities, and we've done that for about 30 years. And then we have an early childhood program that we operate using the parents as teachers model. So we have our presences in prevention, it's in intervention, it's in long-term support. I mean, our main mission is to be there where we can make a difference in people's lives, help them lead the best life they can, and give them the support and treatment that they need to do that.
So Mark, one of the things that I know, I deal with when I talk to folks, and I think others do as well, is, when we talk about disability service providers, behavioral health services, most folks are like, that's great. We love what you do. What you do is very important. But I don't know that everybody makes the connection about why organizations such as yours are so crucial to what a healthy community looks like, to healthy communities. Can you kind of pivot a bit to talk a bit about, in terms of what Transition does, why is what your organization does important to a healthy Quincy, to healthy communities?
I'll talk about a few different areas that I think were the most impactful. I'll start with early childhood. When we work with parents and kids who there's some concern about their child being ready for kindergarten. And so we're doing home visiting to try to help their parent be the best parent they can be, which a lot of times is about interaction. And it's about identifying delays that a child might have. If we can help a child who is on the trajectory towards long-term disability have less disability in their life, we've made a change that's lifelong. Another service we do is mobile crisis. So we respond to about 700 crisis calls a year as an agency. And we go wherever the crisis is at. If it's at home, if it's at school, if it's someone who's gone to an emergency department and needs advice about whether a family member might need to be hospitalized for a mental health condition. My staff can save a person's life by helping them to decide that I really need to be in the hospital for safety, or hey, our family really needs to huddle around this person, give them more support, and maybe even watch them for a time period until they're safe. And then for people that need long-term supports, people who have more challenging disabilities that go into their adult life, us being able to provide supports that help, it makes the difference between someone living in an institution. I mean, our roots as an agency were people in Quincy didn't think it was right that people should have to live at a state hospital to live their life. And the fact that we offer supports that help someone live in an apartment who in the past would have lived in a group home, or that we give supports for someone who's in a group home in the past would have been in an institution, that changes their life. And if we weren't around, that wouldn't occur. The other thing that occurs is it also has a huge impact, the services we do, on the family members of those people. Someone you love in the past had to travel halfway across the state to get a service, and now they can live close to home. That's an amazing change for their life. Or because we offer a day program, for example, and that there's funding for that person that they're caring for in their home is able to go to that program, that allows that caregiver to have a job. So, I mean, in a variety of ways, we have an impact. And so those were just a few.
Mark, thank you so much for sharing that. One of the things that I absolutely love is being able to sit back and hear about the different ways that an organization such as yours touches a lot of lives. and improves lives and creates opportunity, creates an environment for recovery. I think folks just don't understand enough in terms about the different ways that transitions and others are able to promote healthy communities by virtue of everything that you do. And so I think it's probably commonly understood that, but just in case, it's organizations such as Transitions and similarly situated ones work with the state of Illinois on contract to perform a lot of these services to folks that are enrolled in Medicaid, but also not necessarily. And so, a big part of that comes into play, these next several weeks, and that our Illinois General Assembly will be in session through the end of May. And one of the most important things that they need to do is pass a budget by the end of May. And what they put in the budget has real ramifications for what organizations such as yours are able to do. Could you talk a minute about what would be important for the General Assembly to do to advance the work that Transitions is doing?
I think people probably are the least aware a lot of times of developmental disability services because a lot of the services occur kind of behind the scenes. If someone lives in a group home, most group homes don't have a sign out in front of them saying, hey, this is a group home, because they want people to kind of blend into, be integrated into the life of the community. So they aren't like some programs where you're like, wow, they're out in the public and you know what they are. But these programs in Illinois are really broken. And they have been broken for a long time. And they broken enough that the state of Illinois has repeatedly been sued by advocates saying, you at least need to do, if you have a job as a state, it's protecting your most vulnerable people. And, when Illinois' level of spending for people with the most severe disabilities is like in the lower tier of states, in some studies it was like 47th in the nation, that is something that's a real problem. And so, the state has a lot of things to consider when they do a budget, and there's a lot of needs out there. I would just say that I think Illinois needs to take where they have been with developmental disabilities and bring it up to scale a while, because we're not where we should be. We're a wealthy state. We can do better than what we have been doing. Living along the Mississippi River, if I move to Missouri, even Missouri, that most people would think is a pretty conservative state, they're kind of in the mid-pack of states. So right. Illinois actually spends less per capita on developmental disability services than Missouri does. So, if I had a child, maybe I'd want to live in Missouri. So if I'm in Illinois and I'm trying to attract someone from out of state to come work in Illinois, and I'm told, well, your adult child might have to sit on list for several years before their number comes up, that's a problem. So I guess if part of it is this is kind of an invisible thing to a lot of people, and the system has in some ways been broken for so long. The good part is right now it's a great opportunity. There's been there's federal stimulus money which probably could be applied partially to this problem. There's been a rate study that was done by actually the state of Illinois sanctioned to kind of look at like what would fixing the system look like. So there's kind of a pathway there. We're just really advocating for the legislature to take a close look at that and figure out how they can get us in a better position than we are right now.
Mark, I think that was a very honest and direct response, and I know I really appreciate it. I think your colleagues, as well as anybody that watches this, will appreciate that. Give us organizations the means to continue to do what we do and to thrive and to invest in our workforce. The fact that I'm always amazed at the incredible work of our not-for-profit disability and behavioral health providers in our environment. I do believe that we can be headed in the right direction with funding this study, learning from what other states such as Missouri has done in the behavioral health space. We're teed up for it. We just need to execute. And I agree, as the 5th largest GDP in the country, we stand to do the work that needs to be done to get back to a place of pride in how the rest of the country works at Illinois. I think we've got good leadership. We just need to back it up with the funding that's necessary. So, Mark, I can't thank you enough for the time. Thank you for joining us today.
Glad to be here. Thank you for having me.
Yep, and I'm looking forward to connecting face-to-face as soon as we can. I hope you have a wonderful day.
Thanks a lot, Josh.